Welcome to Mission Bay, the campus of UCSF and home to the Northern California headquarters of the National Multiple Sclerosis Society. My name is Matt Frenzy and I'm a Board of Trustees member with the local chapter here for the MS Society. I'm also a Californian living with MS, and I know firsthand how important it is to have early, consistent, and effective treatment for chronic conditions, especially MS, in terms of improving both health and quality of life. Unfortunately, I also know the potentially devastating financial impact the cost of effective treatment can have on patients and families. Too many MS patients and patients living with other chronic conditions such as rheumatoid arthritis, leukemia, breast cancer, HIV, Hep B, are forced to stop taking their medications because they can't afford the costs. Recently, California health insurers are moving vital medications to so-called specialty tiers, which shifts the financial burden more directly onto the patients and puts the cost of treatment beyond the reach of most patient populations in our state. That's why the common sense patient protection legislation that Assemblywoman Fiona Ma will announce today is more critical than ever, and why the National Multiple Sclerosis Society is pleased to be here today with Assemblywoman Ma and other bill supporters. Today we'll hear perspectives on the impact of specialty tiers and the cost of medication from patients, patient advocates, physicians, and the legislative community, including Dr. Douglas Gooden, who's here from UCSF, Melanie Rowan, a San Francisco attorney who's living with MS, Michelle Vogel, the Executive Director of the Alliance for Plasma Therapies, and Mary Lou Lewinko, CEO of San Francisco Medical Society. But we'll begin today with Assemblywoman Fiona Ma, representative of California's 12th Assembly District. Fiona Ma was re-elected in 2010 to represent the people of California's 12th Assembly District. This district includes San Francisco, Daly City, Colma, and Broadmoor. Last year, Assemblywoman Fiona Ma was appointed to serve in the leadership position of Speaker Pro Tem. Assemblywoman Ma has authored groundbreaking legislation to protect young children from toxic chemicals, especially those that are found in baby products. Her law, first in the nation, bans the sale, manufacture, and distribution of these toxic toys. The European Union and 14 other countries have already adopted similar bans on the phthalates that make up the toxic portion of these toys. 4 of the 6 phthalates in this bill are known reproductive toxins in California's Proposition 65. They interfere with the hormone system, and studies have shown these toxins lead to reproductive defects, premature birth, and the early onset of puberty, which of course is a risk factor for breast cancer. In 2007, Assemblywoman Ma spearheaded the San Francisco Hepatitis B-Free campaign, which seeks to screen and vaccinate all Asian and Pacific Islander residents, with long-term goal of making San Francisco hepatitis B-free. The campaign puts San Francisco at the forefront of the nation in fighting chronic Hep B. It is the largest, most intense healthcare campaign for Asian and Pacific Islanders in the United States, and this initiative has received national attention, as being looked at as a model by the California legislature. Prior to her election to the Assembly, Fiona Ma served on the San Francisco Board of Supervisors, 2002 to 2006. She was district representative part-time and former Senate Pro Temp John Burton from 95 to 2002. President Bill Clinton appointed Fiona to various small business positions. She's a licensed CPA in California since 1992. She received her BS from Rochester Institute of Technology in New York, her MS in taxation from Golden Gate University, and an MBA from Pepperdine University. Without further ado, we'd like to welcome up Assemblywoman Fiona Ma.
Thank you, Dr. Frenzy, for sharing your story with us. I have chronic hepatitis B, and I'm the poster child for the hepatitis B campaign. And so when I hear that folks who are on medication all of a sudden have to pay extraordinary prices to get their medication, that sounded an alarm in my head. People should not have to choose between their prescriptions or food, and it should not be a choice between bankruptcy or living. And today I want to thank Melanie for stepping out and telling her story, but her story is only one of probably hundreds or thousands of people that are now facing this crisis in their lives. And we're here today to let the public know that we are not going to put up with it. We are going to fight for the everyday person. We want to make sure that anyone who needs their prescription medication gets it and can lead the quality life that they need to lead. So today, I want to thank all the nonprofit organizations who are co-sponsoring my bill here today. It is critical for consumer access. Healthcare, I think, is on the forefront of everybody's minds. 61% of Americans take some form of prescription medication every day. And so it is critical that we provide that comfort to them that they can indeed get the medication that they need and live healthy, productive lives. So again, thank you all for coming out today. Thank you for supporting my bill. It's going to be a tough 9-month process. We already know that opposition is mounting from the health plan side, from the people who are stand to make money from people, and my message to them is that they need to think about people first and profits last. So thank you very much.
Thank you, Assemblywoman Ma, for your remarks and for your leadership on this issue. Next, we'd like to hear from Dr. Douglas Gooden, who is the director of the Multiple Sclerosis Center here at UCSF, a neurologist and an internationally renowned expert in the treatment and research of multiple sclerosis. Dr. Gooden?
Thank you very much. So I'm here today representing the physicians, I suppose, and I think it's very important to understand a little bit about MS. MS is a disease which can be very devastating. The average onset of age is about 25 or 26, so it affects young people before they've really had the opportunity to be in the workforce very long. We had no treatments for MS at all until 1993, when the first medication, beta interferon, was introduced. All of the other treatments had been sort of marginally effective or not effective at all. And all of these medicines now are biologics, which are extraordinarily expensive. I think the cheapest of them is probably $30,000 a year, and the most expensive goes up to $50,000, not including the testing that needs to go on. It's really important for medicines to be given early in the course of the disease. Now, it's not to say that any of the medicines that we use actually can cure the illness. None of them are cures. But we have no medicines at all that reverse the injury. So once the injuries have happened, we cannot reverse them. So the best we can do is to give the medicines to people early in the course and have them stay on the medicine, reduce the biological activity of the disease, and prevent them from developing disability that they would otherwise have developed. And I think a lot of patients struggle because they're not wealthy. They have a huge copay. In fact, one of my patients actually was struggling with $1,000 a month in copays. It's $12,000 a year. And she wanted to do that because she felt that her health was more important than other things. Now, fortunately, I think that she could afford that. That is, she didn't have to sort of sell her house and everything else. But the fact is, these medicines should be made available. The insurance companies should cover, if you're paying for the insurance, they should cover it to a reasonable degree. And I think that's why the MS Society and the MS Center, and I think most of the physicians who deal with this disease, support the idea of having some cap on the costs. Thank you.
Thank you, Dr. Gooden. Next, we'd like to hear from Melanie Rowan, a San Francisco attorney living with MS. She's going to talk about the impact of the cost of medication on her treatment in day-to-day life. Melanie?
Thank you. Good afternoon. My name is Melanie Rowan, and I'm 33 years old. I live in San Francisco, and I'm an attorney, and I have multiple sclerosis. I work at a nonprofit organization serving lesbian, gay, bisexual, and transgender people and their families, and I've been struggling with multiple sclerosis since I was 28 years old. I first began experiencing symptoms of multiple sclerosis the year after I graduated from law school. And the first thing that happened to me was that I had an attack of optic neuritis, which is an acute inflammation of your optic nerve and can make it difficult for you to see. This made my job a lot harder because I couldn't actually read for several weeks when I was first struggling with it. Fortunately for me, I was able to recover my vision from that initial attack, but since then I've had to be very careful to make sure that something like that doesn't happen again. My goal as a patient with MS is to keep MS at bay and just stay as healthy as I can. For me, staying healthy means that I need to take what's called a disease-modifying drug, a drug that will prevent the disease from progressing any further. And my neurologist has told me that without disease-modifying therapies, I'm really gambling with my future, that every day that goes by that I'm not taking a disease-modifying therapy, I am risking cognitive function down the road, that when I'm older, my brain won't work the way that it should. So I can't afford to just wait and see what happens with my medication. I need to be taking it now, and I need to be taking it every single day. So when my doctor initially prescribed me a disease-modifying drug, he told me that I would need to look out and make sure that I didn't have any issues with my insurance company, that there was a possibility that I would have some kind of problem getting coverage. But what I didn't expect was to learn that even though I was covered, what my coverage meant was that every single month I was responsible for 30% of the drug cost. In my case, that shook out initially to being about $650 a month, which was more than I could afford, and at times it's ranged to being up to $880 a month. At the time that I started paying this much per month for my medication, I was already just barely breaking even financially, like a lot of us. I was paying my rent, I was paying down my school loans, and I was also supporting my mother, who has a serious medical condition and lives in an assisted living facility. So adding on what amounted to another person's rent to my costs every month was really backbreaking for me financially. I didn't feel like I had a choice. Like most people with MS, I prioritize my health as much as I absolutely can, so I just started to pay for it. And after a while, that meant going into credit card debt in order to keep paying. And I had no idea actually how I would get out of that cycle. I couldn't see an alternative, so I just continued to pay. After 2 years, my doctor suggested that I could possibly switch to a new therapy that would be riskier. And before I actually knew whether I could take that therapy, I just stopped ordering my drugs because I thought, well, I can get a few months break here while I transition to a different drug. I don't have to pay for this anymore if I can avoid it. I just really needed a break from those payments. So I went unmedicated for a while, but now I'm able to take the new therapy, which is fortunate. I'm still struggling to work off the credit card debt that I incurred during the years that I was paying that much for my drugs every month. And I think about often the fact that my neurologist has told me that stress is a big problem for people with chronic conditions like MS, and in MS in particular, and that I need to stay away from stress if I'm going to stay healthy. I don't think it's a coincidence that during the time when about a quarter of my monthly income was going to my medication, I had 3 MS attacks, including another bout of not being able to see for several weeks, and a period of months where I couldn't feel my feet at all. So I think the stress that I was undergoing because of the cost of my medication have actually negatively affected my health, which is counter to the purpose of the drugs and isn't good for anyone long term when you think about healthcare costs. I think that no one should have to choose between taking the drugs that they need for their serious illness and doing something like paying for food or paying their medication or supporting their parent who has a serious medical condition. I'm very grateful to Assemblymember Ma for bringing this bill, and I hope that it passes, and I urge everyone to support it. Thank you.
Thank you, Melanie, for that very personal insight into the impact of the cost of medication and treatment. Next, we'd like to hear from Michelle Vogel, the Executive Director of the Alliance for Plasma Therapies. It's a national nonprofit organization established to provide unified, powerful voice to educate about diseases that rely on plasma-derived therapies. Michelle?